Okay, ma'am, good morning. So for today, we will be assessing your skin. So first is establish rapport to the patient, which I have done earlier. And next is explain the procedure to the patient so that he or she will cooperate better once he understood the procedures. So ma'am, we will be assessing your skin so that we can see if there is any unfamiliarities in your skin. So next is assemble the equipment and supplies, which is the ruler, the gloves, and the magnifying glass, which is here. And next is do the hand washing, which I have done earlier. So uh, now I will be doing only the alcohol. So after the hand washing, we will provide privacy to the patient. So if we are in the hospital, we will close the curtains or the doors of the room. So next is inspect any unformity of the skin color. So ma'am, lay your hands here like this. So after assessing the unfamiliarities in the color, record your observations. So next is assess the edema if it is present. So ma'am, can see your feet. So there is no presence of edema. So next is inspect or palpate and describe skin lesions. Use gloves if lesions are open or draining. So I will be using gloves. So after wearing the gloves, we will observe and palpate the skin moisture, the dryness, the oiliness, sweating, or if it has too much sweating. So far, based on my observations, there is no unusual things happening on the patient's skin. So next is palpate the skin temperature compared to feet and to hands and using the backs of your fingers. So far, based on my observations, there is no unfamiliarities happening on the patient's skin. So next is note the skin turgor. So far there is no. And lastly, document the patient findings in the chart. So next, ma'am, we will be assessing your hair. So first is establish rapport to the patient, which I have done earlier. Explain the procedures to the patient so that he or she will cooperate once he understood the procedures. So ma'am, we will be assessing your hair if there is unfamiliarities happening, and that will that will be a problem to your health po. So next is wear your gloves, which I'm wearing right now, to eliminate the spread of microorganisms. Next is the impact and the evenness of growth over the scalp. So let us check it. So far I have seen none. So next is the impact of the hair texture and the oiliness. So far the patient has a good texture and there is no oiliness in the hair. So next is note the presence of the infection or the infection by parting the hair in several area, and checking behind the ears and along the hairline at the neck. So far there is no. So next is impact amount of body hair. So far the patient has the usual amount of body hair. So lastly, document the findings in the chart. So for today, ma'am, we'll be assessing your nails. So first procedure is establish rapport, which I have done earlier. Next is explain to the patient the procedure so that he or she will cooperate and after he understood the procedure. So next is assemble the equipments, which is the acetone and the cotton balls here, the chair. So next is inspect the fingernails to determine its curvature and angle. So ma'am, can you do this? So the patient has the usual angle of nails. So next is inspect the fingernail and the toenail texture. The texture of the nail may include to the thickness. So far the nails of the patient has the usual texture. So next is perform the blanch test or capillary test or CRT. So far the patient's fingernails are pinkish, and when I pinch it, the color and the blood go back to normal. So that's it. Lastly is documents the findings in the chart. Ma'am, so for today, we'll be assessing your appearance and mental status. So first procedure in this is establish report, which I have done earlier. Next is explain to the patient the procedure so that he or she will cooperate better once he or she understood the procedure. So ma'am, we will be doing this so that we can know if it affects your health or not. So next is do the hand washing, which I have done earlier. So I will only put alcohol in my hands. So next is provide privacy to the patient to avoid embarrassment to the patient. So if we are in the hospital, we will close the doors and the curtains. Next is observe the body build, height, and weight in relation to the client's age, lifestyle, and health. So the height should be proportionate to the arm span. If not, Marfan's syndrome, hereditary disorder that affects the body's connective tissues. So, ma'am, can you stand and place your arm beside like this? So far the patient's height is appropriate to her hands. So next is observe the client's posture and gait, standing, sitting, and walking. Identify individuals' unique movements, determine normal gait patterns, and diagnose issues causing pain, and also implement and evaluate treatments to correct abnormalities. So, ma'am, can you stand, sit, and stand again, and walk slowly? Okay, ma'am, thank you. So next is observe the client's overall hygiene and grooming. Relate this to the person's activities, your activities prior to the assessment. So far the patient's hygiene and grooming is very well. So next is note the body and breath odor. Ma'am, can you open your mouth? Okay, thank you po. So next is observe for the signs of distress in posture or facial expression. Observe at rest during conservation, watch for eye contact. Ma'am, can you look at me? Okay, so next is note the obvious signs of health illness. So far, based on my assessment, the patient's gestures and posture is usual to the normal state. So next is assess the client's attitude. Either he or she is cooperative, unresponsive, or anxious. So far, based on my assessment, the patient is cooperative. So next is note the client's affected mood in the appropriateness of his or her response, like the facial features, the facial expressions, and the appropriate responses. So based on my assessment, a few seconds and minutes ago, she is responding appropriately and expressing his or her emotions appropriately. So next is listen for quality and quantity, quantity, and organization of speech. So when I interviewed the patient so far, her speech is the usual one, and she was able to answer in organized manner. So next is listen for relevance and organization of thoughts. So far she respond to me normally. So lastly, document the observations, findings in the chart. So in the end of the assessment, the patient performs normally.